Hello and welcome to the third installment of the Solutions Caucus Edition of Legislative Digest. With me here today in the studio are three distinguished legislators, one an ex-legislator, so we have both the House and Senate represented. We have Senator Small, we have Representative Buttrey, and former Representative Rob Cook, who for the duration of the program will be referred to as Citizen Cook.
Excellent, excellent.
Thanks for coming. We know you're very busy at this time of the session, and we've kind of been waiting to have you explain your version of Medicaid expansion, which seems to be the signature issue of this session, the big kahuna issue for this session. And we've gotten to the point in the session where there used to be two competing bills, now there's one, and Representative Buttrey, that's your bill, House Bill 658, if I got the number correct.
That's right.
So before we get into the meat and potatoes aspects of the bill, the substance, let's have you guys just explain briefly what the Solutions Caucus is. We've explained it before, but you're new to here, to our studio, so give us your version of what the Solution Caucus means.
Well, I think in a sense it means different things to all of us, right? But to me, what the Solutions Caucus is it's a collective group of Republicans that are more interested in a government that works than to minimize or take down government. I think it's as simple as that. That the current trend is to badmouth and in some perspectives to denigrate government, and in fact we all know we need it, right? I like the streets plowed, and I like the services that government brings us, and those services require solutions and a lot of political clout.
Do you want to add to that?
Yeah, I think Rob, Citizen Cook, is right. You know, we're a group of people that have committed ourselves. We baseline, we believe in the same things that most all Republicans believe in. We are very conservative in how we address things, but we also realize that we live in an imperfect world. And so our group are folks from all different disciplines, from all different parts of the state that understand that policy needs to be understood, it needs to be read, and we need to make individual determinations to see how we can move the ball down the field and make things better for Montanans. We're not a group that sits around and decides or orders people in how to vote or how to feel. We more bring adverse opinions together, we listen to everyone, and out of that usually comes good policy. So we do know that there's a lot of people that set up a line along the goal line and make sure that nothing ever crosses the goal line. We're more the type of folks that grab the ball from the other team and race and shoot down and score a touchdown in the other end. We are not afraid of complex policy. We can understand it, and in cases where we can't, our group has gotten so large that we have policy experts in almost every area, and so we can rely on each other to make sure that we're making good decisions. But I think the underlying theme of the Solutions Caucus is that we seek out good policy, we read bills, we make determinations based on what we think is right, based on what our constituents need. That's why we were all sent to Helena, and we're not afraid to take and make hard decisions.
Yeah. Do you want to add anything to that, Senator Small?
Well, it's fairly tough to add anything to it.
Yeah, it's very both articulate.
Exactly, and they covered every angle, and I have to go right back to the start with it. And you know, primarily to me, this is a group of people who just tend to get stuff done, and you have to reach across the aisle. Generally not a hardline stance on anything, but just effectively making government work.
Yeah, well, I'm glad you added that, working across the aisle, because that's the only part I was going to ask. That, you know, by definition, to get things done, that will require, on occasion, even when you're conservative, you have to deal with the minority party to get things done. So,
well, I think that you're a little bit off if you think that one party is always right and one is always wrong. There are folks on the other side of the aisle from where we sit that are actually very good at policy. They have experiences that we don't. And to involve them in the discussion, quite often you go, wow, they've got great points to make. And we've seen that with Medicaid. If you look at the iterations of the first bill draft to where we are today, there are significant differences, not in the goals that we set to obtain. We are still meeting every goal that we think we were sent by the people to implement into the program, but doing it in a way that is usable by government, that's affordable by government, and is also something that the people that are part of the program can sustain and that they can work with. That takes input from all sides. And sometimes the other side of the aisle, you'll get good ideas and at least things to think about as you draft policy.
Yeah. We frequently talk about the virtues of a citizen legislature, and I think you just addressed one of them, is that you all come to the job with varying experiences, life experiences, professional experiences, and the collective is what works, is we
Right.
bring all that together. So, the Solutions Caucus, it's a great title. I want to ask you a question, the answer to which is probably self-evident, but I want to ask it anyway. What is the problem, or what are the problems you are addressing as a caucus with House Bill 658? So this is a segue to the bill
Sure.
itself.
I think we implemented a program in 2015 that was based on a set of federal guidelines that were one-size-fits-all policies, which never works. And we've really tried to discourage that type of policy coming out of Washington. We can't even do it in Montana, as large a state as we are. It's very hard to do something that's going to work for everyone. And so we knew that the rules had changed in Washington over the past 4 years. We know that we've collected a lot of data on the original HELP Act. We could build in more efficiencies, we could make government more responsible, and we could implement those rules changes and waiver changes that had happened at CMS. We definitely had anticipated law changes, and we addressed that in the original HELP Act as well as in the new act, which we call MARIA, Medicaid Reform and Integrity Act. But we didn't see any law changes. But we saw changes within the waivers that are allowed through CMS.
Can you just remind us what CMS
Center
is?
for Medicaid and Medicare Services.
And that's a
And so
federal overreaching.
It's federal
they're a
oversight.
federal agency, and they are allowed to deviate in some ways from the intent of the federal law, and that is actually in the law, that they can allow waivers, they're called demonstration waivers, so that states do have some ability to decide how they're going to implement the program customized to their state. Now, these waivers are let out in very tight fashion. There are certain things they can't do, but there are certain things that they'll allow individual states to do. So those rules at CMS did change, and they still meet the intent of the federal law, and we're simply taking advantage of some of those changes. We have a large population in the state of Montana that's on Medicaid expansion, but we also have a very large population in the state of Montana that's paying for Medicaid expansion. So as Republicans, we not only need to worry about the people that truly need the services, but we have to look out for all taxpayers to make sure we are utilizing their money in a way that is going to best benefit the state, both in the short term and long term.
Yeah.
And I would say more fundamentally even than this iteration, and the sunset on the original bill is the reason that we're allowed to actually encompass these decisions by CMS. But more fundamentally is the fact that there's 100,000 Montanans without insurance, right? And like it or not, that costs us either in Medicaid expansion or it costs us individually in private premiums. And so the money is generated on the healthcare side from one avenue or the other. And it's more efficient, I think, to do this through Medicaid expansion than it is to do it on the private sector premium hikes and the things that we find intolerable. Right? It's a lot of money in private healthcare, and to ensure that you actually have the right coverage. And so I think that's foundationally for me. I think there's a moral dilemma, right? And that is that people should be insured.
Yeah. So what are some of the reforms that are built into the bill? You know, what makes this approach, your approach, which is now I could call it the winning approach before we get to the finish line, but it's the bill that's still in front of the legislature and sort of pending the final acts of the legislature and the governor's approval and all that. What is it that needed reforming in your view? Differentiating
Sure.
your bill from this carry forward, just continue as is, which is a bill that was just defeated the other day
Right.
in the Appropriations Committee.
Well, I think I'd start out by saying you referred to it as the bill. I think the bill is House Bill 2, the budget, and of course we've got infrastructure and a lot of other things. This is one of a group of very important bills, I think, that affect a lot of Montanans. If we want to look at reforms that were important to us, I think MTN did a survey which showed the results that 76% of Montanans either agreed or strongly agreed that Medicaid expansion participants that were able to work and were not working should have to work and provide some benefit to the community in return for getting taxpayer-paid health care. So that we call that community engagement. That's a big part of the bill, and we think that that is what the population told us they wanted. We are real famous for coming up with Montana-made solutions. You could say things have been tried in other states and not worked. We had that same argument in 2015 that there's no way the HELP Act would work. We came up with a good solution. I think we've done it again. We also need to incorporate reforms in state government. We needed to make sure that when someone signs up for Medicaid expansion, there's actually verification of their income, so we know the right people are on the program. We needed to make sure that if someone has a change in circumstances, if their income changes, or if they have a change in health, which might move them from having to meet a community engagement requirement into an exempt category, that we were actually talking to people and we were making sure they were in the right group. And I think most importantly, Citizen Cook was absolutely right that these people that are affected by Medicaid expansion have always gotten health care. That's something that people don't realize. We have been paying for the health care all along. Yeah. Usually it's been after they've been chronic, either mentally or physically, or when they're in an emergency room, or when they're heavily addicted. And addicted-fueled rages tend to kill our children and hurt our population. These are things we are paying for. So if we don't have it, either folks are getting health care through charity care, which is being cost-shifted onto our insurance costs, or they're being picked up by another program such as traditional Medicaid or another program within state government, which we pay higher rates for. So by moving this population into a program under a set of federal rules that none of us really likes, we were able to reduce the cost to the state. And in Medicaid expansion, we only pay for the services that that person needs and is required to help serve that person's health. We're not paying anything else. It's when they get the services we pay for those costs if they're needed, and then we pay some administration costs. So it's an efficient, it's an effective program. And again, in the long run, and we even saw it in the short run over the past couple years, 2.5 years of it being implemented, significant savings to the state of Montana. If we do not have this program, we need to immediately add $58.6 million back into our state budget. And we'd have to find that money because that amount of people would be moved on traditional Medicaid. And then the rest of them would go back to using the emergency rooms, having cost shifting. We would have seen our individual insurance policies raise an additional 8 to 12% higher than they are now had we not had Medicaid expansion. Because we reduced the cost shift, the charity care, the uncompensated care significantly, and that benefited people that hold insurance. So I think it was a lot of making sure government was actually ensuring the right people were on the program. We've redefined the taxpayer integrity fee section so it's usable, and it will be implemented fully this time so that if someone has assets, that they are helping to offset the cost of the program. We have addressed the community engagement. Some people call them work requirements, but that's only one way that you can meet it. To make sure if you're in that small group of people that are able-bodied but not working, if you want to have the taxpayers help you with your health care, you are going to provide a benefit for yourself, your families, your community, and your state. And that's really the gist of what the program is. It's a long bill. Yeah. There's a lot of reforms in it. But we think that we have done the job that we were sent here to do, that we saw from the results of I-185. The population didn't want Medicaid expansion as is. And the results of the surveys, they want folks to have some accountability, and we built that into the plan.
Yeah. Now, I've got a question for you, but before I get there, just because a lot of people aren't necessarily familiar with some of the terminology. This is a complex subject, and you've got a complex bill, and that's what the Solutions Caucus likes to do, is engage in the complexity. But you've mentioned charity care. Let's just help everybody understand what that is.
Okay. A nonprofit hospital, by its very foundations, has to, in exchange for, in essence, a tax privileged position, right? They don't pay taxes. Has to provide a certain amount of charity care back to the community, which is just, in essence, free care that's written off. But of course, it's not free.
Yeah.
Right?
So that's where the cost shifting occurs.
Yes, and so the hospital makes that up on the rates that it charges to private insurers.
Okay,
And so
well,
if someone comes into the emergency room, for example, federal law does not allow us to turn them away. So the hospitals are required by federal law to serve people that come into emergency rooms and in certain other circumstances. That's irregardless of that person's ability to pay. But obviously, healthcare is expensive. Drugs are expensive. Surgeons are expensive. These costs that those people accrue when they don't have insurance or cannot private pay simply get cost shifted onto everyone else. So they call it charity care or uncompensated care. And at the end of the day, the hospital's got to keep its doors open. It has to pay the bills, has to pay for the consumables and the drugs. And that type of care then, when it's paid for, gets shifted onto the insurance commissioner
yeah.
or the insurance user.
So getting on to the reforms that you've itemized there, you know, in general, if this is fair, you're wanting people who need the services and deserve the services, if they can afford to pay more than they do under standard Medicaid expansion, you've created a series of measures that will collect from them one way or another. So they're more invested in their own health care.
Yeah.
So I'm sort of getting to where the criticism that I've heard is that you're kind of describing a lot of enforcement mechanisms, data collection, administrative activities that may be new and different. And people raise questions about that cost. Do you want to talk a little bit about
Sure.
those costs?
And I think as we talked a little earlier about the latest amendments that went on the bill yesterday in Health and Human Service Committee, that was really the results of finally getting access to government agencies and talking with the experts that would have to implement the program and looking at the fiscal note that they wrote and saying, well, why are you thinking you need a new big computer system? Why do you need a new building? Why do you need so many people? Why is it cost like this? And once we were all sitting at the table in typical Solutions Caucus style, they said, you know, we have systems, we have programs. If you could look at the wording, if you can look at some of the existing language in TANF and SNAP law, some of these things we already measure, and if you can change a few words and still get the same outcome, our policy is still the same, then we don't need new computer systems. We already measure this data. We can simply grab them from other areas. And that's all the amendments did, was make sure that it was usable by the participant in the plan, and that government could utilize systems that already exist in most cases and collect the data from the users in a very non-invasive way in other cases, so that they met the original intent of the bill, but it did it in such a way that it was affordable to the state. And that was something else in the plan that I neglected to bring up, is we know the federal dollars are shrinking. When we originally incorporated the program, the feds paid 100% of the cost. Now that's going to drop to 90%, where the state share is going to be 10% of the cost. We're not quite there yet.
Does it stay there? Once it reaches that threshold, does it
As
stay
federal
there?
law exists today, it stays there, but now we've also addressed what happens if it doesn't, and I'm sure we'll get to that. We wanted to make sure the taxpayers of Montana did not have to foot any additional bill while that federal money decreased. So we looked at the parties that benefit from the program. There are three of them. The providers, the hospitals that actually provide the service, they used to not get paid for, and now they are. We wanted them to pay into the system. The insurers who have had the benefit by a reduction in the increase of the insurance policy costs, they've benefited. We want them to pay. And the participants in the program that are benefiting, we want them to have stake in the game also. So through the hospitals, the insurers, through premiums and increasing premiums for some parties that choose to stay on the program longer than we would like, and also through the taxpayer integrity fee for the folks helping to pay for the program that have significant assets, we've generated more money than the reduction in the federal money coming into the state.
Oh.
So we can say our goal was met, that we are not to continue the program, even at reduced federal funding. We are generating enough funding from the parties that are involved and benefit that it doesn't cost the taxpayers anymore.
Yeah, and there's one other specific item that maybe you included in your description right then, that premiums on work comp premiums, there's
Right.
a new tax on them or an increase.
Right.
That
but
figures into all this?
It does, but it's not specifically on workers' compensation. It's for all not-for-profit insurers instead of.
No,
Montana,
there is work comp.
Okay.
Yeah, there's the Montana State Fund.
Yeah.
is a work comp insurer. They are the only ones right now, and there are lots of private insurers for workers' compensation insurance. Everyone else pays a 2.75% premium tax. Montana State Fund does not.
Okay.
So as we look for funding mechanisms, because in this plan, we also put money towards economic development, because we want the state, we just don't want to find folks that are not being successful in the job world and just throw them out, because then they're going to cost us more. We wanted to give the state some money to focus on those people, to find out what their barriers to employment or better employment were, and to actually have to touch every one of them and make sure that we are helping them be successful, as we already have in a volunteer program. Now we're requiring them to touch these folks and offer help so they can become successful, and then ultimately, if they don't want it, they come off the program. But workers' compensation, we had two goals there. One is we wanted to level the playing field so that the state fund, which is a quasi-government agency, does not have a competitive advantage over the private sector. Plus, we have to remember that 54% of Montana businesses have employees that are on the HELP Act. So that business is not having to pay for health insurance for some or all of their employees. That's being done by the taxpayers. This is a very, very, very small way for the businesses to participate. In reality, a healthy, unaddicted workforce has a lot less injuries than a addicted or not perfectly healthy workforce. And so when we look at studies from other places, there's a lot of studies out there looking at the workplace environment. When you have a healthy, unaddicted workforce, your workers' compensation rates drop. So I think we're going to find out that by getting more people healthy and more people involved in the workforce, we're going to see work comp rates drop, and I don't think any business will ever see an increase.
Well, I'm glad you brought health back into the picture. You know, we're getting into the details, and they're important details of the bill
And
itself.
one thing you need to remember,
Yeah.
this is what was unique to Montana. The original act is called HELP. It's Health and Economic Livelihood Partnership. To us, what made us different, we were the first ones that did it, now everybody's starting to do it, is Medicaid expansion to us was not just about health care. It was just as equally important about economic livelihood. If you want to talk about not creating a permanent entitlement, you want to get someone and get them healthy, but if you can help them get a job and get out of poverty and get skills so they can take care of themselves and their family, that's the win. And so it was just as important to us,
That's okay.
It was just as important to us that we looked at both economic development and healthcare together and didn't just implement a plan that gave people healthcare and said, well, there you go. You know, we want people out of poverty. That's always been our goal. So as we talk about the old bill and the new bill, it's just as important to us that we are working on that financial stability of the participant just as much as their health.
Right. And I think, again, foundationally, you have to understand where we all come from, right? We all come from very, very red districts, very Republican districts. The state as a whole is generally Republican. Mm-hmm. And the solution, Medicaid expansion wasn't popular in 2015. And a lot of that was related to the first take on the Affordable Care Act. But in order to get any sort of expansion, these items had to be in it. You know, we have to satisfy our constituents, or we're not back. And if we're not back, then there are no answers, right?
Yeah. Solutions go away
They do.
if you're not
They
there.
do.
Yeah. Now, I know, Senator Small, you're being very stoic here thus far, and pretty soon we're going to migrate to a discussion of the politics of this as the session winds down. You know, most of the action on this bill right now is in the House, but eventually it's going to reach the Senate chamber. So,
We hope.
In a moment, I'm presuming that things go the way you want them to, and that's a huge presumption on my part. But I'm sharing that it's open. But before we get to the politics, there's one other thing. You know, one of the criticisms of this approach is that most of the people on Medicaid expansion are working already or are in some capacity where they're unable to work or they're caregivers at home and things like that. So that's not really my question. It's more about the reforms that you are advocating here to get people who are receiving the service more invested in it. Do you have evidence of that the program as was or as is at the moment that there was abuse there, that there are people who are taking advantage unfairly of this healthcare service that they weren't able to get before? It's a kind of a sloppy way of asking, but I think you know what I mean.
Right.
I think
Is
that
there
was,
evidence that
well, I
you've
think
used?
that's part of the problem, is the way that the government had implemented the original HELP Act. We weren't measuring for those type of activities. We couldn't tell you exactly, until recently, exactly how many folks were working, and we still can't tell you how many hours they're working. We can't tell you how many folks are in the exempt category and why they're exempt. And we truly can't tell you how many of those able-bodied, non-working people are on the program. One of the beauties of what we're doing, and again, our goal is not to throw a bunch of people off the program, it's to identify which category folks are in and focus on that third group, because those are people that can get working, potentially get out of poverty, still looking at the folks that are working and help them get better employment. But when this act is implemented, if we're that fortunate, we will know exactly where people are sitting, which group or category they're in, and we can focus on the people we can help, and I think we can do a lot more good. So I tell you, it depends on who you talk to. Obviously, in a program of 93,000 people, there is going to be some abuse. We will know exactly who those people are, and we'll give them every opportunity and as much help as they need to get with it and to help themselves and their families. But at the end of the day, if they choose not to, then they aren't folks we want to be focusing the use of taxpayer money on.
Yeah, absent the facts, right, which was the data that wasn't available until just a short time ago, perception becomes the reality in politics. So the only way you change that perception is with a repetition of the facts.
And data.
And it doesn't just take one application, unfortunately. Once the perception is made that this program is supporting a lot of able-bodied people who are just freeloading, then it's a lot of work to undo that. And unfortunately, that a lot of Montana voters feel that way.
Yeah, I follow you. Before we get into politics per se, every bill has a fiscal note that has spending associated with it. This one has a big, thick fiscal note, and they're fun to read, but sometimes hard to understand. And I know you've taken issue, and you're not the first or the last to take issue with a fiscal note, because we'll remind the audience, you guys have the bills drafted, you write the bills, you present them, but it's the budget office of the governor who actually creates or constructs the fiscal note. And we know from reading in the paper that you've taken issue with this one, you haven't signed it. So the question is about, briefly, what's wrong with the fiscal analysis, and have you crafted your own response? And I'll just say one more thing, is that in the papers, there's been reference to a university study that indicated that if your bill went forward as it was before it's amended, half the people who got onto Medicaid expansion would be kicked off. And that's probably exaggerating, but that's the general gist. So what about that fiscal note? How and why is it not good to accompany your bill, and what's the alternative way of calculating the actual
Sure.
cost to society?
Well, I think, and we've all seen the studies, and I think the one you're alluded to is, I think, from Georgetown University, and so we've got I believe a DC-based university deciding how we do business in Montana, and again, how we implement things, and I heard these same arguments in 2015, by the way. But I think the way the bill was originally crafted, in a lot of ways, was a draft of how I saw it happening without the knowledge, in-depth knowledge of how the government system worked. So the original fiscal note did make the assumptions that 50% of the participants on the program would not remain on the program, and that 50% of those folks that dropped off the program would go back to traditional Medicaid, which is a very huge expense for the state of Montana. That is a lot of the dollars you see in the fiscal note is 50% dropping off and half of those people going back onto traditional Medicaid. I didn't agree with that then. I certainly think now that we've been talking with state agencies and getting their ideas and how to make this work so we're not implementing computer systems, we're not putting this horrendous reporting burden on the participants. I think government now believes that won't happen. I've requested a new fiscal note, and I believe we'll have it when and if this bill gets to the Appropriations Committee, and I think that will be much more realistic. But there's a set of assumptions in the original fiscal note that this population is going to go in half, and all that the state is going to have to pick up the healthcare costs of a vast number of these people, and that's just simply not true.
Right. To give you an idea of the difference, the cost of an individual on Medicaid expansion, it's about, you could, as versus traditional Medicaid, right? You could put 3 people on expansion with similar medical conditions for every person you put in traditional Medicaid. The state rate is about 30% for Medicaid, 30% or more. Whereas the expansion rate is capped at that 10%. So that migration, just the migration of an individual from expansion, where where you're contributing a dime on every dollar, to traditional Medicaid, where you're now 35 cents or more, is a good portion of the reason for the fiscal note.
Yeah. Okay, if I heard you correctly, the bill as it stands right now, and things are going to change, it's in the House Human Services Committee, or has it been voted out already?
It has been voted out, it's been read across, it likely will be on the House floor tomorrow, I would imagine. So it's in the possession of the body of the House. We will not have a new fiscal note for the floor session, but we have a fiscal note, and if it were to pass second reading, it would then be referred down to the Appropriations Committee, where the new fiscal note would be addressed and discussed, and if it were to pass there, then it would go to third reading in the House.
Okay, so I think we can.
And that all has to happen by Monday.
Yeah, I know a tight time frame, and this is sort of perennial thing in legislative sessions where the important bills are dealt with in short form, well, not short form, but in a short, tight, concentrated time frame. So let's just presume that's going to happen in the next few days, meet the deadline, and it then finds its way to the Senate Finance and Claims Committee, if that's the place.
Well, it's probably go to
Senate
Senate
Health.
Health.
Senate Health. Senator Small, I'm desperate to get you engaged in this, and so I'd love to get, just your view as a legislator of this measure in total, or something more specific. What is it that brings your attention to this bill, and what do you hope to see result from it? If there's anything, different, distinctive.
Well, I come from a little different populace than these guys do. My Senate district actually has 2 reservations, and I'm a tribal member myself, so there's just no denying the benefit of what Medicaid expansion has brought to my area, and it's something I support wholeheartedly. Rob started out by saying, I believe we should have roads and this and that. Not everything is in program. I'm sorry, I'm kind of stumbling there, but in programs like that where we have the opportunity to help a subset of people that definitely need it. Meanwhile, they put together a program here. Ed has spent a lot of time and energy and everything else to put together a program that is going to help the people who actually need it, and maybe not necessarily those who are just grasping for straws on it. So back to where I come in, having the reservations in the IHS system, the people in my district a lot of them are 100% FMAP. They're a little bit different under the system, and that's where I came into play primarily, was trying to help with the language with that. But it has brought health care through the Indian Health Service system from life or limb policy basically up to preventative health care now, and it's just something I can't go without in my area. And that's not counting the FQHCs in the area and everybody else that has actually benefited from it. I live in an extremely rural part of the state, and healthcare is just one of those things that you can't go without.
Yeah. Well, we're not going to back up and have you identify all those acronyms, but IHS will say, it's Indian Health Service.
Yes.
Well, okay, let's just stay with you for a minute, because let's just collectively assume that the bill does succeed on the House floor, goes to House Appropriations, and is passed out of there. It ends up in the Senate committee. What would you say about your Senate colleagues? What's your expectation there? Is it really different kind of political atmosphere than in the House?
Yeah, I think
And I'm skipping over the opposition that these guys are going to face in the House. We know that there's not 100 votes for this bill. But what makes the Senate a little different in your expectation?
Well, for one, there's less people.
That's important.
Yes, and the annex generally aren't there. It's a little more calmer body, but you see it every day up there when they're passing bills. You'll see a bill that'll come through the House 80-20, and it'll hit a committee in the Senate and get tabled. It's a whole different set
So
of roadblocks.
it's not a slam dunk by any
not
stretch.
necessarily. Yeah.
No.
There's roadblocks every which way you go with everything we do, and it's just a matter at the end of the day to get enough people along for the ride to actually make something work.
I kind of like the old adage about investments, right? Past performance is not indicative of future success.
Well, each of you, what would you say is the biggest hurdle yet to overcome in either chamber?
I think we're seeing it now. It's all the boogeyman in the corner. It's the philosophy as to who you think we are serving on the program and why we're serving them. It's lack of knowledge as to what happens with these people if we don't have Medicaid expansion or if they're not on the program. There are not a lot of folks that understand healthcare law, healthcare systems, Medicaid, Medicare. And it's much easier to take an ideological stance, and we saw that. And I had nothing to do with healthcare in my first 2 sessions, and I simply got involved because in the 2011 and 2013 sessions, I saw, as we were debating Medicaid expansion, I saw 2 distinct groups. One that said, trust the feds, just implement it, it should be healthcare for everybody. And the other side said, no matter what anybody offers, the answer is no. And it was the ideological extremes, but everybody was there. And what was frustrating me was no one was in the middle saying, now, wait a minute. The state of Montana is sending a lot of money to D.C. for this program. We have an incredibly aging and incredibly chronic and unfortunately an incredibly addicted population. As a Republican, I cannot bury my head in the sand and think that magically our people are going to become unaddicted. We're going to lessen the amount of diabetes and heart disease and all the things that are happening when folks don't get preventative care. But this is just magically going to resolve itself. We're Republicans, for God's sake. We solve problems. We tend to listen to people. We search out solutions. We dig into the data, and we solve problems. So why are we not solving this problem? So I think that's the biggest thing is it's sort of the ideological combined with not really knowing what you're talking about, not understanding that we have a very needy population that we can have a huge effect on, and we have had, and that if we do nothing, things are going to get worse. I would honestly say if we, in 2015, had decided to do nothing and we continued that through 2019, we would not be far away from being a bankrupt state, because we would have to pay for these people that have become chronic, both physically and mentally, and couldn't take care of themselves ever. They were not going to be curable. Now we've implemented a program that might take 10 or 15 years to really understand how many people we got unaddicted and got working and kept from getting diabetes and heart disease and cancers, what that's really going to be worth to the state, let alone their families. So it's stating the facts. It's having a lot of probably blustering going on the House floor tomorrow, answering questions with the facts, trying to keep it unemotional and within what is true and what's not true, and letting the legislators make a decision on their own. And I know it's a hard one for our folks on the other side of the aisle, because they truly do not believe in any sort of work or community engagement requirements. It's just not in their core. So they'll have a decision to make as to whether they think Medicaid expansion is important enough under a very fair set of rules, which they've had input on, that we can continue the program. Or do they take the ideological stand that if it's got work requirements in it, no.
Yeah. Well, I don't want to ask you to speak for the governor, but ultimately, again, let's presume you prevail and the other side of the aisle goes along with you. I mean, they've done so in effect on a limited basis already. In the end, the governor is in this position to decide that same question.
Sure. We took a big risk in committee when work requirements and some other basically poison pills were amended into Representative Cafero's bill. No one knew what those Democrat members of that committee would do.
Yeah.
I mean, it's a risk. We could have lost both bills. We'll have that same risk in the Senate, and we'll have it with the governor. Now, I've been transparent through this process with the governor and with the Democrats, and you know, I certainly have heard their objections, and some of their ideas were really good, but they will have a decision to make. Ultimately, the guy that has to sign it is a Democrat, and I hope we can show him the benefits of what we're doing, but it's going to be his decision.
Well, I want to segue as we wind down toward the bigger picture, the political environment in which all of this is taking place on a national scale as well as in the state. But before that, you know, you've articulated the main hurdle, which is an ideological position, whichever one it is.
Yes.
There are two of them. I look at the bill and I see some other things, and this kind of leads to the big picture. There are some technical parts of a bill, and they're not unusual, that sort of make it contingent on context, one of which is a non-severability clause, which in a nutshell, if any part of this complex bill is found to be unconstitutional or is challenged and successfully challenged in a legal environment, then the whole thing collapses. And then there's another one called contingent voidness, which is a really interesting thing to think about, contingent voidness. But it also has a similar effect. In other words, there's sort of two contingencies here that could bring the whole thing crashing down. What do you want to say about those?
Well, I need to update you because
maybe those aren't there anymore.
As I amended it, we actually, and it took me a while, and again, sometimes I have to open my ears and listen to understand the real threat of non-severability. And it wasn't just being sued against the community engagement requirements, but as a non-severable bill, anyone, a Republican, a Democrat, anyone, could sue any portion of the bill if they didn't like the bill, and they could kill it all. So we really struggled with how to address that, and what we've done at the end of the day is we've made it severable, but we have made the community engagement section have a sunset if it's found, if it's deemed unusable by a court. So the bill is severable, but if a court says that the community engagement provisions cannot be implemented, then a sunset takes effect. So it's a contingent sunset. And we think that's important because other parts, so let's say we've addressed the 501D situation. These are some parties that were never intended to be originally on the plan. They're on it. They have to be on it if they choose to because of federal law, but they've agreed to pay their own share of being on the program. It's a great solution. They have accepted it, and they've testified as a proponent of the bill. But if someone were to find that part of the bill objectionable, in the end, it's not by any means a major policy of the bill, but we don't want to lose the whole program because of that section. So I think we've now come up with a really good plan. There is a contingent voidness section. It depends on a waiver, and that is on the part of the bill where we increase the premiums the longer a person is on the program. And if CMS finds that that waiver is not approvable, then that section would go away in the contingent voidness section. So we've got a plan that survives, keeps the program going. With or without the work requirements, we have incorporated reforms through Medicaid expansion and all of Medicaid that are incredibly responsible for the taxpayers of Montana. That goes on no matter what, but if the community engagement provisions are struck down, then the bill sunsets.
Yeah, and just to make that more clear, if the work requirements are successfully challenged, then the entire program, Medicaid expansion, will sunset again in 6 years. So,
and the reason for 6 years is we know we've been watching Kentucky and Arkansas. There were judgments again this week against their work requirements. This will need to work its way through the Supreme Court. We could have put a 2-year or 4-year sunset, but in talking to law professors that are following the healthcare cases, because Kentucky and Arkansas tried to fix their programs before they appealed, they tried to fix it, they were sued again, they lost. Now they'll start the appeal process. We're likely looking at 4 or 5 years before the Supreme Court would make that final determination. Mm-hmm. So we can come back and spend a lot of the taxpayers' money reworking the section, get sued, it gets stayed. We come back, we work it gets sued, it gets stayed. We think that we've got responsible sections that can be implemented and not sued, and will do a lot of people a lot of good. But if they are, we'll be able to address it when we have a final determination from the highest court.
Okay. Well, it's great to hear about the ability to be nuanced, in a complex arrangement, that there are tools available to you as lawmakers to make these changes to avoid collisions, to avoid lawsuits. So the last subject I want to address is, again, the big picture in which all of this is taking place. You've already mentioned several other states that are having challenges made. My question has to do with what's going on, of late, very suddenly in Washington, D.C., with the administration sort of proclaiming that, that the Affordable Care Act, under which all of this takes place, may be determined to be unconstitutional in its
Yes.
totality.
Yeah.
And I don't know, as a citizen, whether, how serious this issue is, but it sounds like it is, in which case, is all of this sort of hostage to what's going to take place above us all?
Well,
I don't mean at a higher level, but
Yeah.
at a more expansive level.
Well, it most certainly is, but first, you want to rate the level of the threat, right? The president has drummed up what is a pretty old decision by a federal judge to say that the Affordable Care Act, lacking the tax that was put in place, is unconstitutional. This opinion by a judge has been reviewed extensively, and most legal scholars on both sides actually rate it as a very low threat level. And so, if it were to hold and get through the U.S. Supreme Court, then of course the whole Affordable Care Act goes away, and all this discussion becomes moot. But I would, I'm not much of a prognosticator when it comes to legal proceedings, but I would rank this one as not worth the worry.
So,
I'll prognosticate a little bit.
Yeah.
So it was all dealt with in 2017, the President Trump's tax plan, which removed the individual mandate. The court, when they had originally ruled on the ACA, had found that to be a power under Congress's taxing power. When the mandate was removed or brought down to zero, there was a Texas decision that said that takes away the power and authority of the ACA from that original court decision. But Judge O'Connor in that decision, while he made that tax unconstitutional, he stayed the program, he stayed the ACA so that it could remain implemented as this case works its way up the courts. And so that's going to take some time. Now, it should be stated in the original HELP Act, we did put provisions in there that if the program changed, then Montana's program would go away unless legislative action were affected. Or if the program funding was reduced, then there were only two choices. The users of the program had to make up that complete reduction through increases in premium, or the legislature would have to act. Absence legislative activity, or the people making up the entire cost shift, the program dies. That was in the 2015 bill. It remains in law under the new Maria Act. So we are covered as a state if the federal laws change. But all these decisions from Judge O'Connor in Texas are moving up their way to the Supreme Court. Who knows what the Supreme Court will do? It was a Supreme Court justice that made the ultimate vote that allowed the ACA to move forward. He is still on the court. It'll be interesting to see what happens. But we've covered the state of Montana and the taxpayers in any case.
Yeah.
Right, and you've asked about the court side of it, right? And there's also the federal congressional side. I think the outcome of the last interim elections, where by all measures, they figure at least 20 seats were decided on the issue of health care.
Mm-hmm.
And so I think Republicans at the federal level have a different respect for the Affordable Care Act than they had in the past, as it's going to relate directly to their electoral success.
Yeah. Well, I've run out of probing questions, not that any of them have been probing necessarily, but is there anything else about the bill and about the process and about the big picture that you'd like to comment on before we wrap this up?
Well, I think, once again, just like the folks in our caucus, our Solutions Caucus do, I think through time and a lot of changes and a lot of listening and input, I think we've crafted a very, very good bill that will serve the people that are the most needy, that will look out for the taxpayers of Montana, that has triggers to make sure that we address issues that raise within the program at both the state level and the federal level. We are measuring, we're auditing, we're making sure that we're doing all the things right. That's got us where we are in the House. With a little bit of help over the next couple days, I hope we can get across the line. We picked the smartest and the biggest senator on the Senate side to carry it. And
With the littlest name.
with the smallest name, yeah. But this is just who we are. If you look at the policy that's been, the really complex policy that's been crafted and brought across the finish line over the past number of sessions, it's always the same people. And those are the people, and some of them have been our harshest enemies over the years, and they've migrated themselves into our Solutions Caucus because they get it. The ideological world is an easy place to live in, but if you truly want to do the job we're sent here to do, you need to really work hard. You need to move that ball down the field a yard at a time. People know that that's what we do. We welcome anyone to talk to us, to learn about policy, to help us make better decisions. And our group has grown quite large over the past number of years. And again, we don't make people vote or tell people how to vote. We simply ask them to be part of the process. And it's exciting. We'll resolve this somehow, some way, because of folks like Jason and Rob and the rest of the group, and then we'll go on to the next challenge.
All right. I think that's a good place to end. So Citizen Cook, Representative Buttrey, and Senator Small, thank you for being here and explaining a big, important bill that's complex and it's on the move, and we're going to know in due course, in short order, whether it's going to, we're going to cross that goal line or not.
Yeah, whether or not we're successful.
Yeah. So thank you all for watching this edition of Legislative Digest with the Solutions Caucus. I think we may have one more show in the series to go, so please stay tuned.